Homepath, Special Expert Clinical Repertory. Homeopathy is like an ocean, and its pearls of wisdom are scattered everywhere in the literature. We have taken help of various experts who have not only collected these pearls, but put them in a string and created a beautiful necklace in the form of expert repertories. Not only that, they have tried and tested this work on thousands of patients and presented you in the form of tried and tested knowledge base, the Expert Clinical Repertories.
These are some of the best clinical experiences shared. Hence, it makes today's homeopathic practice efficient, sticking to the homeopathic principles. Homepath is introducing 20 special repertories based on the clinical conditions. These special clinical repertories concentrate on specific conditions only, like thyroid, hypertension, AIDS by Dr. Tarkas and Dr. Ajit Kulkarni, repertories by Dr. Prabhakar Shetty and Dr. Balbir Singh, and also repertories on suppression, obesity, asthma, pneumonia, etc., which are useful in homeopathic practical applications since they give us the specific characteristics and homeopathic information pertaining to that disease condition which is difficult to find in any other repertory.
These repertories are result of extensive clinical work of the authors, useful for fast application, gives the precise rubric, useful when there is a lack of specific symptoms, especially in clinical conditions when symptoms are common for that disease condition, useful for children, elderly, bedridden, physically challenged, comatose patients, as well as for veterinary use. AIDS repertory. AIDS is a very new and important topic in the area of homeopathic repertory. Homeopathic work on AIDS is very scattered and limited. Homeopathic information is available about AIDS.
Dr. Tarkas and Kulkarni's work on AIDS is well compiled in a repertory format covering physical complaints, causative factors, emotional state, complications of disease conditions and associated conditions. For example, see the most commonly found state of low-grade fever in AIDS patient described with only few but important specific remedies.
Thyroid repertory. This is a special clinical repertory concentrating on conditions of thyroid only and is useful in homeopathic practical applications since gives the characteristics specific to thyroid only, which are difficult to find in any other repertory. For example, when the causative factor is grief, the remedies those instantly come to our mind are natrum muriaticum, aurum, etc. But the thyroid repertory proves its distinctness and gives a very specific remedy for thyroid complaints from grief as amyl nitrogen, which we will never normally think of when prescribing conventionally. See the rubric: thyroid gland, general, goiter, exophthalmic, grief, from, and the confirmation of the same is found in materia medica, which probably we will not consider if we do not refer Homepath.
Hypertension repertory. Hypertension is a very commonly found clinical condition in our practice. This repertory on hypertension by Dr. Kulkarni is very simple and short, but covers all the aspects of the disease condition, making it a very useful tool. This repertory gives very common but important rubrics. Hypertension types. Asymptomatic, a very commonly found condition but difficult when it comes to the remedy understanding for this condition.
Prabhakar Shetty's Repertory. Prabhakar Shetty's repertory covers various bodily conditions with very characteristic rubrics pertaining to that condition, along with very minute differentiating points within the rubrics. The author, from his clinical experience, beautifully describes the subtle difference in two close coming rubrics, defines them individually, and provides two different sets of rubrics, hence making the rubric more characteristic and the prescription more precise. For example, see the difference in deafness and dullness of hearing, where two are close coming conditions but not the same, and an absence of clinical repertory from homeopath. One will go for a general rubric of hearing loss or from any other repertory. Ear, deafness, typhoid after. Ear, hearing, dullness, typhoid after.
For more details and deeper understanding, please contact us on info@mindtechlive.com or visit our website hompath.com and mindtechlive.com.